Diabetes is a long-term condition marked by elevated blood sugar, glucose, levels. The primary source of energy for human body cells is glucose. When glucose is not effectively absorbed by the body cells, it builds up in the blood and can lead to a variety of organ problems. Diabetes has a number of consequences that can threaten a patient's life if they are not adequately managed. The hormone insulin, which is produced by the pancreas, an organ behind the stomach, regulates blood sugar levels. When a person has diabetes, their pancreas cannot create enough insulin to meet their body's requirements. The body's cells cannot take in and convert glucose into energy without insulin. Type 1 and Type 2 diabetes are the two categories into which diabetes is often subdivided. The immune system of the patient targets and kills the insulin-producing pancreatic cells, resulting in Type 1 diabetes. Because of this, blood glucose levels rise, which damages the body's organs. Autoimmune diabetes is another name for Type 1 diabetes. The exact cause of this autoimmune disorder is yet unknown. The patient's hereditary factors, which are also influenced by environmental circumstances, are thought to be the most likely culprits. The most prevalent type of diabetes is Type 2. This type of diabetes is brought on by the body cells losing sensitivity to insulin, which prevents the body from properly using the insulin-generated body cell resistance to insulin. The majority of diabetics worldwide, between 90 and 95%, have this kind of diabetes. In addition to these two types of diabetes, gestational diabetes is a unique form of the disease that affects pregnant women. Within a few weeks or even days, Type 1 diabetes can manifest itself suddenly. As a result of the nonspecific symptoms of Type 2 diabetes, many patients are unaware that they have had the disease for years. Type 1 and Type 2 diabetes both share a number of traits, such as I'm frequently thirsty. A lot of times, especially at night, to urinate. I am frequently quite hungry. Loss of weight without obvious cause. A loss of muscle mass. Ketones can be found in urine. Since the body cannot use sugar as an energy source, the breakdown of muscle and fat produces ketones as a byproduct. Distorted vision. Wounds that take a long time to heal. Recurring infections of the skin, vagina, gums, or urinary system.